As the pandemic swept across the world, healthcare workers became the first line of defense against the virus. They treated patients in hospitals, clinics, and other healthcare settings, and also provided essential services such as testing, contact tracing, and vaccination. Many healthcare workers also took on additional roles, such as delivering food and medicine to vulnerable populations, and also providing mental health support to patients and their families. The Covid-19 pandemic and the lockdown was a challenging time for people all over the world. Healthcare workers were called heroes during the lockdowns because they were on the front lines of the COVID pandemic, putting their own health and safety at risk for patients who were infected. They worked long hours in difficult and often dangerous conditions, often facing shortages of personal protective equipment, also known as PPE, and other resources, all while trying to save as many lives as possible. Their heroism did not go unnoticed, as people around the world showed their appreciation and support for healthcare workers during the pandemic. Many people clapped, cheered, and displayed signs of support from their windows or balconies during the early days of the pandemic. This recognition was a way to show gratitude to those who were risking their lives to save others, and to acknowledge the vital role they played in the fight against COVID-19. The heroism of healthcare workers during the lockdowns was also highlighted by the media. Their stories were covered extensively, with many healthcare workers sharing their experiences on social media and in interviews. They described the challenges they faced and the emotional toll of caring for patients during the pandemic. It's also worth noting that the heroism of healthcare workers extends beyond the pandemic. They have always been essential to our communities, working to save lives, alleviate suffering, and promote health and wellness, from routine checkups to life-saving interventions. They put themselves at risk every day to care for patients and to ensure that our communities are healthy and strong. In addition to the physical risk of caring for COVID-19 patients, healthcare workers also face mental health challenges. Many were dealing with anxiety, stress, and burnout as they worked long hours and witnessed the suffering and death of patients on a daily basis. Some healthcare workers also face stigma and discrimination, as fear and misinformation about the virus led to hostility towards those who were perceived as potential carriers of the disease. This included healthcare workers who were working tirelessly to care for patients and help control the spread of the virus. Despite these challenges, they continued to provide essential care and support to their patients during the lockdowns. They showed tremendous courage and selflessness, putting the needs of their patients and the communities above their own, and their sacrifices helped to save countless lives. Nurses are an essential part of the healthcare workforce, and they were at the forefront of the fight against COVID-19. They worked tirelessly to care for patients, administer treatment, and provide emotional support to patients and their families during the pandemic. They faced significant challenges during the lockdowns, including shortages of PPE, long hours, and high levels of stress and burnout. Nurses are also at the forefront of advocating for policies that support healthcare workers and promote health equity. They work to address the social determinants of health, such as poverty, housing, and food insecurity, and fight for access to affordable healthcare for all. Like nurses, orderlies and phlebotomists also face significant challenges during the pandemic: shortages of PPE, long hours, and high levels of stress and burnout. They might not receive as much recognition as nurses and doctors, but their work is just as essential to the healthcare system. They are often the unsung heroes of the healthcare workforce, working behind the scenes to ensure that patients receive the care and treatment they need. They are essential members of the healthcare workforce who played critical roles during the pandemic. Home health aides, personal care aides, and healthcare service workers such as housekeepers and cooks are also essential members of the healthcare workforce who played critical roles during the pandemic. Home health aides and personal care aides are responsible for providing in-home care to individuals who need assistance with activities of daily living, such as bathing, dressing, and grooming. They also provide companionship and emotional support to their clients, who are often elderly or disabled. During the pandemic, they faced significant challenges, such as increased risk of exposure to the virus and shortages of PPE. You can see there's sort of a pattern here. Despite these challenges, they continued to provide essential care to their clients, often going above and beyond their normal duties to ensure that their clients were safe and well cared for. Healthcare service workers such as housekeepers and cooks also play critical roles in the healthcare system. Housekeepers are responsible for ensuring that healthcare facilities are clean and safe, while cooks provide nutritious meals to patients and staff. During the pandemic, they also face significant challenges, including increased workloads and exposures to the virus. They often put themselves at risk to ensure that healthcare facilities remain safe and operational. The home health aides, the personal care aides, and the healthcare service workers are essential members of the healthcare workforce. It's important to recognize and support all healthcare workers for their heroic work during the pandemic. The pandemic highlighted the importance of these workers and the challenges they face in providing essential care to their clients. In recognizing the heroism of the healthcare workers, we also need to address the inequalities and injustices that exist within the healthcare system. This includes addressing disparities in healthcare access and outcomes for marginalized communities, as well as ensuring that healthcare workers themselves are treated with the respect and the dignity that they deserve. To support healthcare workers, it is crucial that we provide them with the resources they need to do their job safely. This includes adequate supplies of PPE and also support for their mental and emotional well-being. It is also important to address the systematic issues that have contributed to healthcare worker burnout, such as understaffing and long work hours. We can all play a role in showing appreciation and support for healthcare workers. This can be as simple as thanking them for their work or making donations to organizations that support healthcare workers. By coming together to support our healthcare workers, we can ensure that they can continue to be the heroes that we need. Thank you for watching. Stay safe.